3,000 deaths per day occur in children under 5. Such deaths are a result of malaria. 3,000 deaths is equivalent to 7 jumbo jets full of children crashing per day. Health systems in developing countries are comprised largely of remote facilities in rural areas where health records are kept on paper, which results in delayed submission of community health information to the Ministry of Health at regional and national level. The delay can take several months. A solution is needed to speed up the sharing of information so that the health system becomes proactive rather than reactive. The proposed solution is the Integrated Health Information Gateway, otherwise known as HESY. The HESY system is a solution developed for healthcare planners to have a common operating picture. It will also facilitate in the planning and allocation of scarce resources at the right time, in the right quantity, and to the right location. The benefits of the system are it will aid in planning, resource allocation, and sharing of health information. It will also introduce transparency into the health system. The sample case used in this presentation comes from the country of Tanzania, the disease being malaria. Tanzania reports 14 to 18 million new malaria cases per year. Now let's look at the structure of the application as well as some use cases. The entity relationship diagram shows the tables used by the system and how they are related to each other. Example use cases used in this application are how to add a new case, how to generate a record for the Ministry of Health, how to determine the length of stay, and a report showing case by day for a specific facility, as well as how to generate a map for displaying usage of insecticide-treated nets. The goal of adding a new case is to provide patient health information over time that the doctors can use to guide care. The length of stay determination will indicate whether facilities are able to meet demand. Sending records to the Ministry of Health in real time will ensure that accurate depiction of a community's health is being made known. The availability of the case-by-day report will add value to the health facility in terms of better planning as well as ensuring resources are available. The insecticide-treated net usage map will be used for targeting the distribution of the nets within the community. Now let's look at the tables within the HESY application. We have here the country, region, district, and town, and the corresponding data. We next have houses table and the health facility table with corresponding X and Y coordinates. You can see some of this sample data. The hospital facility capacity table contains information on the number of beds, nurses, doctors a facility has. The person table feeds information into the patient table. More patient information will be in the patient detail table. Other tables in the application will contain information on medicine, severity of malaria, and the type of mosquito species. The visits table has the patient ID and corresponding admission and discharge date, severity of malaria, mosquito species, location of the patient's home, and the health facility ID, and whether they use insecticide-treated nets. Now that you've seen the tables, let's look at how a user will interact with the system. This will be through the usage of forms. To add a new case, the user will follow step 1 and enter the person's name and click on Submit Record. Next, the user will get a form where a pull-down box will be shown where they can select the person by name and enter the date of birth, gender, health facility information, and then they will click on Submit Record. The administrator at the Ministry of Health will interact with the report menu where they can determine length of stay as well as they will be able to generate cases by day reports. To determine the length of stay, the administrator will select the hospital of interest and click the Generate Length of Stay button. When they do that, they will get an output that displays the length of stay, hospital name, case ID, ward name, and the admission date. To show the report of cases by day, the administrator will click on the Generate Report button. When they click Generate Report, they will be prompted to enter the start date and the end date of interest. The following report will be generated. The cases displayed will be within the selected date range. In this report, we see the month of interest, the gender, age, case ID, and admission date. Now let's look at maps. Information was extracted from the HESY application and sent to a mapping software called ArcGIS. The ArcGIS software creates maps based on X and Y coordinates. For example, in the future, additional tables having census information, provider information, and rainfall information will be added to the system. The first map we're looking at is the country of Tanzania, and the region of interest is Arusha, highlighted in red. From the legend, you can see two areas with the hospitals shown by the blue squares on the map. This map shows location of malaria cases in Arusha. It also shows 3 hospitals in that area. In this map, we are able to see 2 hospitals reporting cases of malaria with length of stay greater than 0. This map shows households with children under 5 who have malaria and are not using insecticide-treated nets. I believe the Integrated Health Information Gateway is a feasible solution. The HESY system will make the availability of real-time data possible, which will result in improved situational awareness, and ultimately fact-based decisions will be made. Thank you very much for your interest and your time. Your feedback and interest is most welcome.